just in. The acute renal injury outbreak has doubled in Australia in the last 10 years. We are broadcasting to you now because without education and early detection, the population is doomed. Acute renal injury, also known as acute kidney injury, has undergone significant re-examination in recent years. The definition has changed from acute renal failure to encompass all levels of kidney dysfunction. This changing definition has caused an inaccuracy in reporting, meaning the true impact of this disorder is not well known. However, what is known is that the incidence of acute renal injury is increasing globally. It can also be acquired within the community, often in lower socioeconomic areas. Community-acquired acute renal injury often affects younger, healthier individuals due to societal and environmental exposures. Lower socioeconomic locations may also be subject to increased risk factors, as well as environmental catastrophes. In Australia, between 2001 to 2013, hospitalisations with acute kidney injury as the principal diagnosis increased from 8,505 to 18,010. That was an average increase of 830 hospitalisations per year. Those living within a low socioeconomic environment and those living remotely had hospitalisation and death rates at least 1.5 times as high as those living in major cities. These figures reflect a combination of determinants, such as access to and use of health services, a safe environment, nutrition, and individual lifestyle choices such as alcohol consumption and smoking. Without proper resources and knowledge, acute kidney injury can progress. A long-term consequence is the development of chronic kidney disease, or CKD. CKD is a major risk factor associated with acute kidney injury, with 30 to 35% of hospitalised patients having pre-existing chronic kidney disease. Indigenous Australians have a higher prevalence of CKD, so it is not surprising that hospitalisations caused by acute kidney injuries were twice as high among Indigenous Australians. As well as prevalent kidney disease, Indigenous Australians also have higher rates of obesity, diabetes, hypertension, cardiac problems, and individual lifestyle habits that greater their risks of developing acute kidney injury. Delayed recognition, unavailability of diagnostic tools, or support from high levels can all increase the effect of acute kidney injury and increase the requirements for treatment. Some patients can recover within days, while others may require months of dialysis and possible transplantation. In lower socioeconomic regions, cultural barriers can restrict an individual seeking treatment. Patients may not trust the healthcare system or may prefer the help of traditional healers. Geographical barriers, as well as access to transportation, impair the chance of early management, emphasising the need for education and preventative measures. If we are ever going to survive this outbreak, health practitioners need to be equipped with the necessary education to identify and adequately manage patient outcomes. Acute renal injury is a sudden decrease in kidney function. This decreased function inhibits the kidney's ability to regulate electrolyte and water balance, resulting in the accumulation of waste products. It is evident this disorder doesn't solely affect the kidneys, and without proper treatment contributes to the dysfunction of multiple organ systems. Acute kidney injury is a common hospital-acquired condition, in particular with patients in critical care units, patients with numerous comorbidities, and older patients. This is as a result of multiple organ failure, a complication of nephrotoxic medications, post-procedures, and sepsis. The duration of acute kidney injury is variable, depending on the severity of the initial ischemic incident and whether it is recurrent.